We'll start.
Okay.
Good afternoon, everybody. It's great to have all of you here, and I welcome Dr. Vijay. And TiE Kerala and TiE Coimbatore has collaborated to also have Dr. Sudha with us today for a session on COVID-19, all you need to know as an entrepreneur. So let's start with a brief introduction of Dr. Vijay. Dr. Vijay is a diabetologist and drug safety physician and entrepreneur with almost 2 decades of experience. He has an MBA degree in service management, and he's the first Indian to be conferred the fellowship of the Pharmaceutical Information and Pharma Co-Vigilance Association. He is also the founder of Ovia MedSafe, a global pharma co-vigilance consulting and drug safety service providing company started in 2012. He has been functioning as the managing director and CEO for that company. He holds several honorary leadership positions in professional associations in pharmaceutical and healthcare domains. He has been awarded by the Indian Medical Association. I welcome Dr. Vijay, and I would request him to please introduce our speaker, Dr. Sudha.
So, thank you for the kind introduction, Swati. I hope I am audible to everyone.
Yes.
Yeah, okay. So, thank you, Nirmal, and thank you, Swati, for this opportunity. And I'm really glad to be part of this initiative, which is a collaboration between TiE Kerala and TiE Coimbatore. And I'm proud to have along with us Dr. Sudha Ramalingam. And it is my pleasure to introduce her to today's audience. So, before that, maybe quickly looking at what the topic is, let me set the context by telling a little bit about the topic, and then I'll introduce the speaker so that she could take over. So, COVID-19, this word has become what do you call a household term, and it has been very oft repeated in all circles. And I don't think there has been any other condition or any other phenomenon that has been omnipresent throughout the world to the extent that everyone talks about the same thing. And to my knowledge, I have not seen such a thing happening in the recent times, not just in the terms of a pandemic, but anything that the whole world talks about, the whole world is impacted. And the most interesting thing being we are still talking about 19, whereas now we are almost 4 months into 2020. So the 19 has actually affected the 20 to that much of an extent. So this everyone must have understood some background about the condition, like it's a viral condition started from China and like spread to the many parts of the world, and we have so much of fatalities and so much of morbidity in the community, with more than 20 lakh patients impacted throughout the globe, and the fatalities alone rising to more than 1 lakh. And it is indeed something important for everyone. But today, the context of this discussion is like there is not just what we call the medical aspect of a disease or a condition. A healthy population is also a population that actually adds value to the country. And if the population is on a whole, if the population is impacted because of some illness or something of this scale, it is sure to affect the economy. And if economy is affected as a result of not just the health, but because of the health, we can't go to work, and there are so many things that cascade into it. And looking at this context of looking at this in the context of a business, so and especially a micro, small, and medium enterprise business, these are at any time they are at much risk compared to the larger enterprises. And a bulk or what you call an effect of a bulk of its employees getting impacted because of this viral disease could actually put a lot of pressure on these MSME enterprises. So it means a lot for business owners to know more about COVID-19, just not just in the context of protecting themselves and their families, but also protecting their businesses and more importantly, their employees as well. Because as employers, we are all bound to protect our employees as if they were our family, and in fact, they are our family. So that is how every entrepreneur, especially from the MSME sector, would think. So in this context, it becomes important for all of us to know more about COVID-19. And the idea of having this webinar is to clarify your medical queries or any information that you want about COVID-19 or anything that you think could impact your business. If you have any queries which a medical person would be able to help you with, like we are not probably experts to talk about economy or how to rebuild the economy. This is probably out of the scope of this discussion. But as as a doctor, as an expert in the field of epidemiology, Dr. Sudha is with us, and she will be able to answer those questions which you think could impact your business from this COVID-19 point of view, and how that can be, what best we can do as healthcare professionals to sort it out for you. So that is the context which I would like to set. And with this background, let me take the privilege of introducing Dr. Sudha Ramalingam. So let me share my screen so that you can see her bio. For I would not want to read it as it is, so you can see that she's Dr. Sudha Ramalingam is a professor in the Department of Community Medicine and co-director of the PSG Fimer Regional Institute. She is the director for research and innovation of PSG IMSR and PSG Hospitals Coimbatore. So she's being a community medicine person, and with a gold medal, with along with a postgraduate diploma in bioethics, she's the right person to talk about this subject. And what makes it very important for, very relevant for us to listen to Dr. Sudha is that she's also a member of the National Expert Subcommittee to revise the Indian Council of Medical Research Guidelines and National Steering Committee. She's a National Steering Committee member of the Health and Environment Leadership Program of PHFI Delhi. So, since her areas, main research areas include environmental epigenetics and environmental epigenetics, developmental origin of health and diseases, and ethical issues involving genetics. So, with this background, she has first-hand experience in the study of epidemiology, and she is here with us to share her thoughts on um, the the condition that is actually tormenting the whole world today. And over to you, Dr. Sudha.
So, very good evening to all of you. And I thank the TiE and Dr. Vijay for inviting me here to lend my expertise in this area. So, coronavirus is like, it's nothing new. It's been there for many years, except that it has been called in different names. Earlier, it was the MERS, Middle Eastern Respiratory Syncytial Virus, and then the SARS. Many of us would remember the SARS epidemic as well. And now it has taken a new avatar, that is the coronavirus, or the disease is called COVID-19. So it's nothing new to us, except that it is kind of, it has taken a new form, which is more serious and which is spreading very fast. So that is why we are all of us are concerned, and because of so much of fatality and so many people are infected. So with that background, it has become a major public health pandemic. Pandemic is like a disease which affects more than many continents. Since it has affected almost the entire world, it is a pandemic now. So we have to take great care, and we have to think of ways in preventing and controlling the spread of this infection in the current scenario. So any questions or anything you would like to know specifically on this, I'll be happy to answer.
So thanks for the crisp outline that you have set up, Dr. Sudha. So the first question that we have is that what is the main reason why we think corona, particularly this COVID-19 phenomenon is an important or it's a dangerous virus? What is the reason why we think it is a dangerous virus? A very basic question to start with.
Okay, so that's a very interesting question. There are several reasons why this is a very dangerous virus. So as I said, it's nothing new. It is already existing in our world. It was existing in a different form. Only the species is like kind of a little different. Because of 2 or 3 reasons, we consider this a very dangerous virus. One is the human population is totally new to this entire virus, which means we are not exposed to this and we don't have immunity to this unless we get the infection and we develop antibodies to this. So it's an entirely new danger that the human race is facing right now. So we don't know how this virus is going to behave, how long it's going to stay in our body, whether we develop lifelong immunity to this or not. Nothing is known about this particular strain. So that is why it is dangerous. The second reason why it is dangerous is because it is highly contagious, which means if one person develops it, there is every chance that he is going to infect at least 3 others. And it's going to grow exponentially. The 3% can become 300, 300 can become 3,000. How we have witnessed in India, the number of cases, it was exponentially increasing. So that is why it is very dangerous. In epidemiology parlance, we have something called as R0, which means the virulence and the infectivity. If one person is getting infected, what are the chances that many others will get infected? So the R0 for this particular strain of virus is quite high. It's like 2.6 to 3 as per the current calculation. The third reason why it is very important is because it is proving to be very dangerous in elderly and immunocompromised patients, as already Dr. Vijay has shared with you. So it is of big concern, and we don't know how it is going to behave, because in certain populations, the behavior is quite different, because even the younger population is affected, and the mortality and morbidity, which means the severity of the disease, is quite high, even in the younger population. So we really don't know what's happening, how this virus is going to behave in every country. It seems to be different. So that is why it is a little, of concern, and that's why it's important. That's why it's different from any other virus which we have witnessed in the human history.
Thank you so much, Dr. Sudha. I think you have set a very clear foundation for the background understanding of the disease. So I think we have more questions which are directly relevant to manufacturers. So one such question is, with regards to manufacturers, what basic key precautions are to be observed in factories, offices to prevent this pandemic, including what basic testing can be done on office staff, workers, and at which points? So there's a little bit of a loaded question.
Right. So there is no definite answer to that. As I said, the current lockdown is going to, phase-wise, it is going to get, eased out. First and foremost, what I would recommend as a public health specialist is to have minimal attendance. Not all workers need to come to work on all days. The individual factories can have a strategy where 50% or depending on the space available. So one of the most important factors for any workforce to work is depends on the space that is available. If you have a larger space, then more number of workers can come, because the social distancing, the 1 meter distance which you have to keep between 2 individuals, can be maintained. If that is not the case, at least you calculate the number of workers that your space can accommodate, so that the social distancing is maintained. So we don't know how long this is going to prolong. We don't know after the May 3rd whether this virus is going to run off. No, it is not so. After that, it's going to grow exponentially, because many people will come out. So the burden of the virus is kind of limited now. But after the May 3rd curfew is lifted, more number of cases can be expected. So it's very important to have social distancing in your factories or workplace. Have minimal attendance if you don't have adequate space. That is number one, a suggestion. Number two, frequent hand washing should be enforced. it should be made mandatory inside the factory. As soon as they enter, you can have a space where they can wash hands with soap and water. You do not provide sanitizers because studies have proven that even soap and water is adequate to wash off this virus. Soap and water, hand washing steps should be followed at least for 20 seconds. You can have posters which can show you the steps in hand washing. It is not like a regular hand washing. It has to be done in a particular way. So those posters can be displayed in your factory. That is number 2. So what screening can be done? You can ask people, your employers, if they have any fever or sore throat or body pain, not to come to work. So if they have any of these symptoms, they need not come to work because it could be COVID. We cannot say for sure, but these are some of the symptoms of COVID. So better ask them to stay at home. That is the third suggestion. And fourth, no specific tests are recommended at this point of time. As per the ICMR guidelines, the Indian Council of Medical Research guidelines, the tests are indicated only for certain people who have traveled or have close contact with COVID and so on and so forth. So as a blanket, policy, you can just see if anybody has any fever or sore throat, or if any of their family members have any fever or sore throat, or have they tested for any breathlessness or difficulty in breathing, or have they tested positive for COVID. So these are some of the preventive measures or the precautions any factory can take before starting work.
Thank you for the detailed answer, Sudha. So one question that has come is a very pertinent practical question that we are saying is do people with wheezing problems like asthmatic, probably the person means asthmatic. So are they more vulnerable to corona infection? Is there anything like that?
So still, we don't know. As I said, it's a new virus. It's behaving very new in each population. So everything depends on the immunity. Both immunity is the body's ability to fight the infection, both locally as well as systematically in the entire body. So in patients with asthma, probably there is some immunocompromised state within the respiratory system, which makes them more vulnerable to the severity of the virus. Based on that, there are studies which show that people with asthma have more symptoms, or the disease tend to be a little more severe than normal people.
So that takes us to the next question on vaccines, which like many people have been asking. So the question here is it is worded as manufacturing, but I see that as development of the vaccine itself. So is the manufacturing of the vaccine for coronavirus difficult compared to other vaccines? If so, why?
It is not difficult. It is being done. In fact, a few news or even press clippings I've seen where the vaccines are kind of ready, and it will take, even if the vaccine is ready, it's going to take at least 6 to 12 months for it to complete all the phases of clinical trial and come to the market. So by the time a full-fledged, a proven vaccine comes, it is going to be at least 8 to 12 months. As per the regulatory guidelines and other procedures which has to be undergone. Having said that, I would also like to keep ourselves, guarded that a vaccine is not the only solution, because the virus itself can change its strain. Like, how it's taking new avatar, it can take another avatar. Just because we are vaccinated against COVID-19 doesn't mean we are not going to get coronavirus. So probably one type of strain we are, kind of protected against. So it's not that it is impossible. It is under the pipeline, but it is going to take time for it to come to the market.
Yeah. So as you rightly said, vaccine is not the only thing, and at the moment our focus is on social distancing. So
Yes.
and you also alluded to the fact that after May 3rd, it's not going to go away all of a sudden. So there is a pertinent question there. In that context, what the question reads is, do you see any risk in rebouncing of infections in India what can we learn from China and South Korea from the precaution steps taken by them to avoid rebouncing in India?
So, as I said, it's not going to be like an easy task now. After May 3rd, it is not like an abrupt stop is going to happen for the virus spread. So, in my prediction, like looking at China and other countries, my assumption is that it is going to be there for the next few months, at least 6 months to 1 year. So, until then, we need to be guarded. We need to take social distancing pretty seriously, and we need to continue this not curfew, but at least the precautions which we are following now, like wearing a mask when we go out, or washing our hands frequently. Even WHO suggests 15 to 20 times to wash your hands with soap and water, at least for 20 seconds. So following these precautions can minimize the spread, is what I'm thinking.
So thank you. And now the oft-repeated drug on the media, hydroxychloroquine. So is hydroxychloroquine as an anti-malarial useful in treating COVID-19? That is one question that we have now.
So everything is, whatever recommendations are coming is based on the current evidence, based on the experience from China or Italy or any other country which has seen the severe onslaught of this particular virus. So having said that, we cannot categorically say chloroquine or hydroxychloroquine is the treatment for this virus. Current evidence suggests that people respond better if hydroxychloroquine and azithromycin is being given. This is based on the current evidence. But I'm seeing papers, even 3 days back, there was an article in New England Journal of Medicine, where they have studied 63 COVID positive patients on severe disease who are not responding to hydroxychloroquine. So there are mixed data that is available. So as of now, the best practice, best evidence that is present, hydroxychloroquine could be a game changer, but it is not 100% guaranteed. So as it is a new virus, evidence needs to evolve so that we can come to a categorical conclusion. This is going to be the drug for this virus. So that's the best we have. HCQ is the best drug we have presently.
Yeah, and I'd like to add to the point that this is a prescription drug, and we are also seeing, unfortunately, scenarios where people have been so carried away by the fear of COVID that they've given these drugs to children, and we have also seen a little, a few fatalities we have seen. So,
yes.
As a pharmacovigilance professional, we are frequently asked about what are all the side effects hydrochloroquine could have, and what could it be so severe? So
sure.
It is obvious that we have to also enlighten the audience that they are not supposed to take the drug themselves, and it is to be given as a prescription. And am I right in saying that we have to reserve it first for the frontline health workers who are actually involved in treating the patients?
So as of now, the government guidelines are like hydroxychloroquine is indicated only in two populations. One is the healthcare worker, as you rightly said, who's coming in contact with the patients. And number two, household contacts of COVID-19 positive patients. Somebody who's going to take care of a patient, then they are given this prophylaxis. Otherwise, for general public, this is not the drug. And as you also rightly pointed out, people should be aware of the side effects of this particular drug. It is cardiotoxic. It prolongs the QT interval. It can cause arrhythmias and death. So, treatment can be more toxic than the virus itself. So, people have to be very, very cautious in using this drug.
So, next we have two similar questions on spreading. So, one question asks, is there anything, how can we recognize a super spreader? Are there any specific symptoms? So that is one question. And a parallel similar question is, can transmission of COVID happen through air? If so, what precautions should we take? And if an infected person sneezes, how long the infection can spread and how far can it spread?
Okay, so super spreader is like recent lingo which we are looking, in the media and other things. So there is no definite criteria which a layperson can know, like, oh, I can't categorically say this person is super spreader. I can't identify a person like that. It has to be done through epidemiological studies. So it means a population, or in South Korea there was a patient number 31. I don't know if you have read this news article, very interesting. Until then the case numbers were very, very less, but this case number 31, she tested positive, but she did not maintain the self quarantine. She did not stay at home, which was advised to her. She traveled and, like, she infected multiple thousands of people. And suddenly there was an acute spike in the cases which are seen in the South Korea. So that was one case. Like, she is called, like, the super spreader. So unless we do proper contact tracing and epidemiological studies, we cannot brand somebody as super spreader. If a cluster comes from a certain population area, like for example, X area in Coimbatore, a lot of cases are reported in the last 24 hours, then we do contact tracing, and then we do epidemiological studies, so that that area can identify the super spreader. But by seeing somebody, we cannot say that person is a super spreader. That is number one. And number two, whether COVID virus can spread through air. Again, mixed evidence. As of now, it's only droplet spread. A person sneezes or coughs, then it spreads. Airborne spread is unproven, not proven yet, though limited evidence is available currently that it is also airborne. WHO has said it could be airborne, but we don't know about the spread. How long it will last in the air, we don't know. So whether it will spread through air, we don't know. So current evidence limits the spread to droplet infection. So how long the sneeze will go? Like, that's why we maintain the social distancing at least 1 meter as of now. So as of now, the recommendation is to maintain 1 meter distance. So that is the thing. And how to prevent it? Wear the mask. You wear the mask, everybody wears the mask. The person is infected, wear a mask. A person is not infected, wear a mask. And currently our government is insisting everybody should wear a mask, so that when you go out, all of us are protected to a certain extent.
So we saw about the spread and super spreaders and that sneezing and that infection. So we have often seen that higher, the news keeps coming both in the lay media as well as in the journals, that the older age group is at a higher risk. We have a question which asks, what is the severity of the disease in the pediatric age group? Are there any specific precautions to be taken?
So the current studies and evidence, the China experience tells that the symptoms in the pediatric age group is not very severe. So they can be asymptomatic carriers, which means they carry the virus, but they don't produce any symptoms. That is related to the immunity of the childhood, that age group. So they're not severely, symptomatic. They don't even show any symptoms for that matter. But they carry the virus. So which means the virus, if there is a child who is an asymptomatic carrier, and since they don't show any symptoms, they can spread the virus to the adults and the senior citizens in the family.
Yeah. So that's a very encouraging and positive response. And coming back to our industry focus, there are a few questions on industry.
Sure.
Maybe I'll pick and choose the most relevant of them. So one kind of a very wide question is like, are there some industries which need to be more careful than others?
Well, the WHO says all wet industries. Wet industries, which means the meat and other industries, need to be extra cautious. That is one. And number two, specifically if they are going to work, too many people are working, then those industries need to be cautious. So these are the things which the WHO has mentioned currently. Other than that, nothing, no specific, instructions that this industry should be more careful than that. Nothing like that. Everybody should be careful. One more care is required for wet industries, is what the WHO has said.
So now, practically, if a worker or an employee has key symptoms of COVID, which we are raising awareness. Everyone is raising awareness about that. So if anyone sees that key symptoms in a worker or an employee, what should be the next step? Should they report to any health helpline numbers, or should they simply seek medical care?
So in the industry or anybody in
In
the
the
neighborhood?
industry, in the industry, either a
So
worker
first
or
of
an
all,
employee. Yeah.
yeah, so better to call the helpline, which is
Mhm.
provided by the government of India, or you can tell your supervisors as per the industry policies and ask them to go for testing. If there are symptoms, definitely testing can be done. All symptomatic individuals are being tested as per the current government regulations. So you can approach the nearest government hospital or the private labs, the list of which is given in the ICMR website. So it is accessible to all of us, common public also. So you can access the list of labs within your area, and you can approach the lab to undergo the testing.
So that was a very relevant answer. And apart from social distancing, are there any special precautions to be observed in factory canteens or mess while mass eating of lunch? Maybe this question is more relevant after the lockdown is lifted, but still this question could be, I believe it could make sense answering it now so that people are more aware.
Like in the canteen? Sorry, I didn't get that.
In the factory canteens or the factory mess where many people have the food together,
Right.
mass eating of lunch. Yeah.
Yeah. So other than the social distancing, other than the droplet infection, the other way in which this virus spreads is through surface contact, which means if you're going to touch something which is infected by the virus, then you're also, and you touch your nose or eyes or mouth, then the chances of you getting the infection is higher. So again, some studies have shown that this virus can stay on the surface for few hours to few days. So you need to be extra careful when you're touching the tables or spoons or utensils. You need to wash it thoroughly with soap and water, and also wash your hands before and after eating or using those stationaries or using the cutlery or whatever it is. This is one of the most important precautions other than the social distancing.
Thank you. So in this context, since you mentioned about that surface infection,
Yeah.
so what is the position regarding taking the daily newspapers from the, the papers being served to the house-to-house newspapers? Can we pick them up? There is a lot of fear about that. And a related question to that is, how about, like, right now we don't have courier services actually active, but once the courier and post services begin, is it safe to handle paper envelopes, and what additional effort should we take to protect ourselves?
So the current evidence as per the WHO guidelines. So there are studies which shows the press release also was there and all that, but I'm talking only about the WHO guidelines, which says papers are not dangerous. You can, get the paper because the virus will stay in paper only for a few minutes is what I'm told. So current recommendation by the World Health Organization is that papers are okay. You can take it. Regarding the courier service, we need to be a little more cautious because we don't know how long it has traveled, where all it has traveled, and who all have handled it. So if a parcel comes, it's better to leave it in the outside, outside your house for a few hours, and then take it up and then wash your hands, like immediately after taking it, and wash your hands with soap and water thoroughly. So that's the current recommendation which I can give based on the studies and also the WHO guidelines.
This is quite encouraging because many people have been really becoming paranoid with so much of information overload. Sometimes it becomes so much of false information coming through WhatsApp and several other social media. So it's important for them to know the right information from the authenticated sources. So one question from the food industry is, like we know that like although hotels, the restaurants are not completely open, still the parcel services are being provided. So there, should they take any special protection and in the management of vegetables or other raw material for making the food? Is there anything that has to be taken care of while doing mass cooking?
So the food industry, because again, vegetables are traveling from different places. When you're preparing food, better to wash the vegetables before anybody handles the cook handles the food. Wash it with salt or soap and water, and then wash it in normal water again. Soap is also dangerous, so wash it with normal water. After you wash it with soap and water or salt and water. That is one recommendation. And once you cut the vegetable, I mean, again, same, as I told you in the canteen, what precautions you will follow for the cutleries. So same precautions for the knives and other things. And once you deliver the food, so today as I was seeing the news, I saw that one of the pizza delivery boys was tested positive. I don't know which delivery portal it is, but it was flashing in all the news portals, and they have kind of traced where all he went, and they are going to do the contact tracing. So it is true. I mean, it will be good to say that in the preparation area, you keep the vegetables clean by cleaning it with soap and water. Using the utensils, again, you have to follow personal hygiene, hand washing hygiene. And when it is being delivered, if you're talking about food being delivered, the person who receives it should be cautious as well, because the cardboards can have the virus for a few hours. So the food may not be infected as such, because right now there is no evidence that if it's going to survive in hot food. So you have to take precautions when you're handling the box or the containers which is being delivered. So that is the precautions which you have to take as a consumer.
So another industry question is like, once the lockdown is lifted and industries start functioning, should there be any mass screening of the workers, the large scale organizations where many people work? So should there be any kind of screening, and how frequently should it be done in the future? I mean, I know it's futuristic, we don't know that much, but what could be your advice at this stage?
So screening is not a bad idea. I mean, even now we suggest mass screening so that we can do contact tracing and quarantine and isolation. But how much the cost effectiveness of screening you have to think about. And what are the tests and the availability and the cost of the kits that are available currently? That also needs to be kept in mind before you have any policies such as screening all employees. So at this point of time, I wouldn't recommend screening as a policy immediately after the curfew is lifted off, because the availability of kits is very, very less. And whatever rapid diagnostic kit that is being talked about in the press, it is not available yet to the consumers in India. And number two, these tests are made available only for government institutions, and that too for specific indications like containment areas or high hotspots and so on and so forth. It's not available for individuals. Like if I have an industry, I would like to screen all my employees. I can't send them there and say, hey, go have the COVID test and come back. It's not like a blood sugar or blood grouping. So there are specific indications when the government or any hospital would do the testing, because the priority is given to contact with COVID positive or patients who are symptomatic. So at this point of time, I wouldn't recommend any screening, but any symptomatic individuals, it's better to create awareness about the symptoms. If you have sore throat, if you have cough or fever, please don't come to work. Something like that. Or if you have come in contact with a COVID positive patient, please let us know. If you are going to an area where it's still a hot spot, where the prevalence of this virus is high, please report immediately to the authorities. So such preventive measures can be taken, and certain policies can be made. And more importantly, make the employee aware that these are the symptoms and you need to report immediately if you have any of these symptoms. So that will be the more, ideal way to go around.
I think that was a very pragmatic advice, and we'll have to take it at the moment, given the limited information we have about the virus itself. And the next question is like, do we have to, do you suggest any antimicrobial sprays being done in the work area, in factories and workplaces with, which have a wide area of working space? Any antimicrobial sprays suggested, and frequently spraying them, will that actually help?
So again, we don't know if the sodium hypochlorite, see the chemical which is used is sodium hypochlorite for spraying and disinfecting the areas. We don't know the effectiveness of sodium hypochlorite as of now. So one thing is you can just wash with soap and water, regular soap and water, which is enough. Surface disinfectant like Lysol or any kind of soap that which you are going to use. That is good enough as of now. But if you want to be a little more cautious, you can try sodium hypochlorite solution. We use like 1% we use in our hostels and the quarantine places which we have in our institution. So that would be enough.
So, and a very simple looking question, but actually it's the biggest challenge we are facing. How to identify the asymptomatic patient?
Absolutely no way of identifying an asymptomatic patient. So that is why we need to be extra careful. You wear a mask always, right? So that is important, and wash your hands as frequently, 15 to 20 times in a day for 20 seconds, right? So that is why these steps become very, very important. So asymptomatic people, we cannot identify unless we are kind of, we get in touch with them, have in the conversation, they say, yeah, I went to Delhi, or like I went to, this particular city where, Mumbai, for example, where there are a lot of cases. So then we will know, okay, so we could be extra cautious. So this person has gone to Mumbai or Maharashtra or where the cases are high. And then we have to be extra careful. And so until proven otherwise, every person is a COVID infected person.
I think that's a very conservative way of looking at it. But I think right now we have to be conservative because we don't have an option.
Exactly.
Yeah. And coming to the masks, there are several questions regarding masks. So which mask should be used by whom? That is a general question. And there is a specific question from a dentist who says there are no N95 masks available in his area, which is a little bit of a secondary town. And he's asking if we can use double surgical masks instead of an N95 mask.
Okay, so regarding the mask, there has been several recommendations. So I'll go category wise. First, for common public, like if I have to go out to go buy my groceries, this mask is required. Yes, right now, what the government says is to wear any homemade mask, which is cleaned at least like every day. Like you don't use the same mask every day. Have 2 masks and wash it in soap and water and then wear it. So for regular people who are healthy, who are going to buy groceries, or you're going out for something, wear the mask and go. That could be a cloth mask which you can make at home. That is number 1. Number 2 category is a person who is taking care of a COVID positive patient at home, or he is a healthcare worker who's seeing a patient, regular patient, like, no close contact, just taking history or something like that. Then surgical mask is enough. That is number 2. Number 3, there are certain people like the dentist, or it could be a respiratory, physician or an intensivist, where he's doing a procedure where a lot of aerosols are generated, like a lot of droplets and other liquids are generated during the procedure. So those people have to wear what is called as a N95 mask. So these are the current recommendations. And now I think the government is also looking into revising this. All healthcare workers will wear N95 mask, irrespective of the patient they are dealing with. So these are the guidelines as of now. So coming to the dearth of N95 mask, it has become a global phenomenon. We are also facing that challenge of, there is a deficiency or like insufficient supply of N95 mask. Whether we can wear double surgical mask, the honest answer is, I don't know, because the efficacy of the protection of N95 mask is the best. So whether it can be compensated by wearing a double surgical mask is still a big question. So I would recommend N95 mask as of now. So there is no replacement for that at this point of time.
So another interesting question is like, in the post-COVID era, should the first aid boxes of industry have anything extra other than what we right now have?
Instead of first aid box, because it's not an emergency. COVID is not an emergency. It's not like an accident or a cut which is going to happen. So the current first aid boxes will always have paracetamol if somebody is having fever. But I would recommend soap and wash stations, like soap and water and wash stations. And also it's a good idea to carry a hand sanitizer when you're going out. Wherever you go out, a person can carry a hand sanitizer wherever the hand washing is not possible. So that would be the only recommendation I can give. And also masks, if available, a person can carry it. Again, it should not be reused. It should be washed. If it's a cloth mask, if it's a surgical mask, a person has to wear a new mask every day. Yeah.
And the next question is everyone's concern about reinfection. So once a person has got COVID and is cured, is there a possibility of that person getting that infection again? And second one is like, even in the once the symptoms are also cleared and the patient is declared cured, in that immediate phase, is the infectivity of the person still there? Is it still contagious?
Okay, I'll take the second question first. After a person has been declared free of COVID, the tests are negative and you discharge, he is convalescing. Whether he is infective? No, he's not infective. So he can be like, he's fine. So don't worry about the infectivity of that person who has tested negative and who is convalescing. That's a good news. The first question, again, it's a mixed evidence as of now. So we were all thinking that a person develops immunity once we get the COVID infection. That is why we're also looking at convalescent plasma, where a lot of antibodies are there for treating severely ill COVID patients. But unfortunately, recently, a few studies have shown that a person who has been declared COVID-free, who's supposed to have antibodies in their blood, have developed reinfection. So that's again reported in South Korea. So few cases have been reported like that. So evidence is emerging regarding this, the immunity status, because it's too early to say for us to say that, whether the person is going to be immune or not. So we have to wait and watch, and we pray that and hope that we get immunity because of this infection.
And I have a question regarding this. Is there a possibility that the reinfection that we are talking about is mere serological positivity and there is no actual illness? Is that a possibility?
See, that is also a possibility because of earlier there was a case which is reported, which was because of the serology positive, because the test that is being done is the PCR, which can still detect the viral genome if it is present. But the recent one, I think they are symptomatic cases. The recent reports, I think it's symptomatic case. So I have to take it, little more cautiously if that is the case, rather than only serology.
Since we spoke of test kits, there is also a question on test kits. Can you explain what is a rapid kit? How does it work?
Okay, rapid test is testing the antibodies which is going to rise after any infection. So if a person gets any infection, the body tries to fight the infection producing antibodies. So there are two types of antibodies. One is the IgM and IgG, so which the body produces. So these antibodies starts rising after 7 to 10 days. So these rapid tests, it's not rapid in the sense immediately today if you have fever, immediately I can test this, for antibodies. That is not what rapid test means. Rapid test means the procedure is rapid, which means I can do it immediately within 30 minutes or 1 hour, I can get the result instead of waiting for PCR, which is going to take 48 hours. So a test which can be done from 7th day of infection onwards, 7 to 10 days or 14 days, these antibodies are at the peak in our blood. So this test can be done between 7 to 10 days or 14 days within the infection. After that, the antibodies start coming down, and then you have to confirm it. Anyway, a negative test does not mean the antibodies like you're free of infection. You have to confirm it with what is called as PCR, polymerase chain reaction, RT-PCR. You have to do. So that is the gold standard as of now.
So then now we have a little different question. Do you suggest usage of any measures including yoga as suggested by Arogya Ministry to help in building immunity? In Japan, all workers do some basic exercise before starting the work. Does it? Do you think something like that will work? This is a verbatim question.
So yoga is kind of a time-tested strategy which we offer for many illness as a complementary therapy. It is not a treatment or per se, but it can complement the existing therapy. So whether yoga is going to increase the immunity, there is limited evidence in the Indian to my knowledge. But many institutes, including Harvard University, they have recommended yoga not only to boost the immunity but also to manage the stress which can occur because of this lockdown and economic issues and other mental stress which can occur because of the virus. So yoga is not just going to address the immunity aspect of it, but also the stress aspect of it. And having said that, also keep in mind yoga is not the single treatment modality. It can complement other treatment modality. It's not that I'm doing yoga so I don't have to maintain social distancing or hand washing. No, yoga is also a complementary practice which you can follow in addition to social distancing and hand washing and other precautions that you are supposed to take.
So then there's a question on clinical trials. Are there any Indian clinical trials going on regarding drug repositioning in the context of COVID-19?
As of now, no drugs to my knowledge, but ICMR has invited proposals for clinical establishments like hospitals and medical colleges for trying out. One is plasma exchange and also convalescent plasma in severely ill COVID patients. So currently the call is open. So anybody who's interested can send a letter of intent. It's a Google form. You can send the letter of intent and they will get back to you with any queries or any other concerns they have. And then you can be part of this multi-centric phase 2 clinical trial.
So coming to, we are almost at 5 o'clock, but maybe I'll take the liberty to ask you the last question probably.
Sure.
There is one question which actually everyone wants to ask, and somebody has actually asked that. All this quarantine lockdown is only a precaution to ensure that we don't go to the next stage. But how will this COVID-19 come to an end? What is that you foresee as an expert in this field?
I should ask only COVID. Right? Okay, the answer is like at some point of time, all of us have to get infected. At some point of time. So it's just a matter of luck. Either the vaccine proceeds or the infection proceeds. So we'll have some kind of immunity, or also follow lifestyle practices to improve our immunity. Exercise or yoga can boost our immunity. So, you can boost your immunity. So in the epidemiological chain, there are 3 things. One is the agent, the host, and the environment. Agent is the virus. We cannot eradicate the virus like how we eradicated smallpox. We cannot eradicate COVID because we don't know any, dynamics as of now. We can improve the environment. We can improve the environment by maintaining social distancing and, keeping the household and other workplace clean by frequently washing and cleaning the surfaces. That is number 2. And third is to improve the immunity of the host. So by doing these things, you can break the chain. That's why we keep saying in epidemiological parlance, break the chain. Either the agent should be eradicated, or the environment should be improved, or the host factors should be modified. The host factors which you can modify is to improve the immunity. It can be either by, getting the infection or improving our immunity per se to fight the, the disease, or the most importantly, vaccine. So these are some of the steps as of now. How it is going to come to an end, we don't know. Unless we all get infected, or we all are immunized, or the virus just goes off by itself, like, by some miracle, it just goes off from the face of earth. That's how it can be eradicated.
Okay, thank you, Dr. Sudha, for the detailed answers to every question. And I think we are already getting some responses from the audience that the session has been very much enlightening, and they have got all their queries clarified. And I think that serves the purpose of this session. Thank you so much for joining us. And I really thank all the audience for your wonderful questions. I really apologize I couldn't put all the questions because many of the questions were too lengthy for me to even comprehend and put forth to Dr. Sudha. But definitely we will try to answer these in another occasion. And with that, I thank everyone, and especially Tai and Nirmal and Swati. And I would like to just conclude by saying that, as Dr. Sudha mentioned, we are not the deciders. We have to just travel with the virus, and it has to have mercy on us and leave it. So let's take all the precautions, and let's be positive in order to not become COVID positive. But at some point we have to meet face to face with the virus and overcome that. And let's hope and be optimistic that it will happen soon. And with this, I hand over back to Nirmal and Swati. Thank you so much for the opportunity.
Thank you. Thank you. My pleasure.
I take this opportunity to thank Dr. Sudha, because I know it's a very hectic time for her, and to take out time from your busy schedule to come and address all our participants. It was a very big thing. Thank you so much, ma'am.
Thank you.
And I thank Dr. Vijay. He has handled the section very well. It's been very informative because he has posted the questions and ma'am has answered them very well. I thank all the participants for taking time out and coming and attending the session. TiE Kerala and TiE Coimbatore has coordinated this event, and we are really happy to have you. And thanks again to Dr. Sudha and Dr. Vijay.
Thank you.